Cecilia Wakesho Mathuva, KTN News.
Two stories on home-based care raising very fundamental issues, and to just help us dissect some of the critical points that have been raised in those stories, joining us tonight here on Checkpoint, Dr. Gladys Mugambi. She's a nutritionist and director at the Division of Health Promotion at the Ministry of Health. Thank you very much for joining us here on Checkpoint. The second story truly painting a picture of what life is like. And when we talk about home-based care in informal settlements in the country, the first story talking about how Kisumu is managing this situation, given the lessons that they learned from HIV and AIDS. So when we juxtapose these two stories, let's begin with the informal settlements. How do we make it right for them to be able to adopt this model and not feel like it's impossible or they're too stretched?
Thank you for the question. As the Ministry of Health, we've come up with guidelines, and what we are advising counties to do is to engage communities so that they can identify areas that can be used for isolation or quarantine. And these are areas such as churches, mosques, halls that are not being utilized, and even some schools. So that is what counties are expected to do, but it requires that you engage communities so that they identify areas that are good for them, areas that they are comfortable with, so that they can continue with their life comfortably because they'll be closer to their homes.
So then how are we communicating this message to Kenyans? It would appear that most of it is just from press briefings. Are we involving community health workers like what we are seeing in counties like Kisumu?
We are communicating using the media. Of course, we've been having the press briefings. We've published this in the paper last Sunday and even on Tuesday, and we have engaged health promotion officers in every county. This information has gone to them, and therefore they're supposed to engage the community leaders so that this goes down to the community. We also had a trainings for community health volunteers. We shared with them the information, and we've created a system whereby we are able to communicate to them from time to time so that they know what they are supposed to do. So this information is continuously being communicated using various channels. We also have radio programs that are running in the local radio stations, whereby we're engaging community to be able to understand them and know what they need.
The issue of cost coming out very strongly anytime we speak about home-based care, and we've seen even from feedback on social media platforms, it cuts across social structures and those who are complaining about the cost of home-based care. How then do we go about it? We're talking about informal settlements that don't have even infrastructure to start with. So the cost of home-based care currently, how do we lessen the burden for those who get infected?
This is a question that actually we need to engage more with leaders, especially at the county level, to be able to come up with a kitty so that we are working closely and helping communities to manage their issues. It differs from county to county, so these costs can be shared between the community and also the government, depending on where we are and what situation is on the ground. So I may not be able to answer the question about whether government will be doing that, because that is not something we have had a discussion about, and it can be communicated once agreed upon. But that is a suggestion.
Are asymptomatic, are isolating themselves at home. Once again, I know this is a message we've packaged so many times. Take us through what they need to do, especially now. One, how to ease in the burden for themselves, even as they isolate at home. And two, how do they lessen the risk to other family members or those they live with?
First of all, those who have been identified be having the virus, they are advised to create a place at home where they can be able to stay. But this should be done in collaboration with the health worker close to them. And for them to be able to manage this situation, they can involve the other family members to see how this can work. And where it's difficult, the community leaders should come in. So this is an issue of community engagement so that the communities can try and see how to lessen the burden, but also as individuals, it's good to see how best they can manage it by either consulting or using the resources they have appropriately so that it can keep them going. So it requires also community participation so that the cost can go lower.
So quickly, as we wind up, when is one discharged? This is a question I've seen a lot of Kenyans ask. When is one discharged? What happens once that is done? How do they need to behave?
We've now known that after 10 days, the patient may not transmit this virus. And if there are no symptoms and a test is done and the person is okay, that person should be left to continue with life. And we're saying if after 10 days you're okay, then you can go back to your work. If you're to continue with your family members, then it's what we are actually encouraging is that family members should accept their members and be able to support them to continue with life. So the issue of how they should behave after that, we are actually saying let people take this as a disease like any other and accept people so that they can live with them normally instead of having stigma around these people who have been infected.
Right, thank you for joining us tonight here on Checkpoint. Dr. Gladys Mugambi, a nutritionist as well as the head of the Division of Health Promotion at the Ministry of Health, speaking to us about some of the latest developments in home-based care, how they're planning and especially on health promotion to reach out to the masses.